Let's see. Make sure I'm muted. All right, good afternoon, everybody. Let me know if you can hear and see me. Hopefully I did this right.
Yep, you're up.
All right, good afternoon, everybody. Let me know if you can hear and see me. Okay, but I have a crazy echo.
I just turned you off. Hang on.
Okay, good. That was on your end because I had everything turned off already here. Excellent. Okay, so we have about 33 people. It's 7 after. Sorry for the couple minutes delay. Jasmine, any announcements for the group to get us started?
I don't have anything big or exciting.
Sorry, we can barely hear you. What'd you say?
No, I don't have anything new or exciting in the last.
You have new or exciting. We should look in your email. There's something new and exciting in your email.
Okay.
I'm not kidding. There is. Okay, well, with that, I will go ahead and do our usual updates as to where we are at. So, oops, that's Hillsborough. Let me share my screen here. All right, let me get to Pinellas. Let me make sure this is refreshed first of all. All right, here's Tampa Bay overall. You can see that our percent positivity is trending downward. That's good. You can see that our overall 7-day or 14-day rolling average is coming down for Tampa Bay as a whole. You can see our bed utilization in the hospitals has kind of leveled off here a little bit. That's largely due to the hospitals putting off elective surgeries. The update from Dr. Shepke at the state level today was 432,000 altogether, 1.3 thousand, so 1,300 on vents and 2,100 in the ICU statewide. Statewide, 9,700 in the hospitals, off of the peak of over 10,000. Looks like maybe a slight downtrend, definitely plateauing for about 9 days. Syndromic surveillance in the ER, so flu-like illness is also decreased a little bit. Statewide percent positive is 11.7. And here's our local percent positive, by the way, for all of Tampa Bay is 9.5. So we're actually doing okay there. If I take you over to the Pinellas specific stuff, you can see that our percent positivity has also declined fairly sharply. There's a question out there about, is this related to increased testing? And I would tell you that the increased testing that we're doing at the Mahaffey, where anybody can come get tested, even if they're asymptomatic and doesn't need a doctor's prescription, if anything, would be likely to make the percent positivity go down, not up. So I think just to answer that question, here's our individual Pinellas County curve here, and you can see we do appear to be on the downslope here. I'm a little cautious because we do see these spikes after weekends throughout this thing, so we'll see what happens in the next day or two to see if that continues. But overall, we seem to be doing pretty well. I can tell you that the number of folks in the ICU is about 15 or so off the high, maybe, yeah, about 15 off the high, which was close to a little over 110 just for Pinellas County. And the number on vents is also down a good bit. I cannot tell you whether those folks are off vents because they got better or because they died. So I don't know the answer to that yet. The reason I want to point this curve out is I know there's been a lot in the news about the numbers and about the deaths. And, you know, this is the highest number of deaths we've seen in a week in Florida. And I would say that that's not unanticipated. So what we have observed in other places that have gone through this is that you get this spike in cases here, but there's a second spike, which we all saw in hospitalizations, which comes here. And then there's a third spike in deaths, which comes here. And so right now we're somewhere in between those second and third spikes, probably, where we're going to see continued increased mortality associated with this. And it just illustrates very clearly how connected we are as a community. It just illustrates how connected we are, that you cannot have this infection in one segment of the population and not expect it to go to another segment of the population. So just, bear that in mind, that we're all in this together. What happens in young, healthy people is going to eventually impact the entire population. So this is sort of where we are in the curve. Again, I think it's, we first saw a spike in cases, then we're seeing a spike in hospitalizations, and then the more severe cases and even the deaths will develop. And that should not surprise us. That's the pattern of this epidemic in many other places. So that's kind of where we are at today. I do think that we're seeing a little bit, and you guys can tell me if you're seeing this as well, a little bit of people being scared to be in the hospital again, due to, just everything going on in the community. So I am seeing folks being reluctant to go in for things that they don't perceive as life-threatening, or even sometimes for things that they do perceive as life-threatening. And just, bear that in mind as you're dealing with the patients, and do your best to alleviate their concerns, that appropriate precautions are being taken to keep them safe in the hospital. The other thing I wanted to say is, please look at that curve and say, well, maybe the things that we're doing are working, and do not say we're done. So the message I want to give you is, keep your foot on the gas, keep driving this thing down. Let's get it back down to where it was a few weeks ago, because we're nowhere close to that yet. And so I do not want us to let up now and then have a whole second spike that we're dealing with for the next month and a half. I think all of us would like to get back to normal life as soon as possible. I know that's unrealistic at this point, and we're going to be in this for a while, and we should expect to have peaks and valleys. And so we just need to know that. Oops, I'm going to have to take this consult. Stand by one. Jasmine, it's all over to you.
Hey, everybody. Do you have any questions for me? Let's see. I just logged into the chat here. All right, I don't see any big questions in the chat. We are just working on CME and PHTLS stuff over here at Station 48 today. So if anybody has questions about PHTLS or CME, you can throw those my way. If you really wanted to hear that consult, tell Doc J to unmute.
Okay, sorry about that. Oh, no. Okay, we're good. So I want to show something else, I think, Jasmine, if I can. And let me pull it up here real quick.
I can talk about PHTLS. What do you want to know about it?
There you go.
I've got questions. I've got answers. All right.
You've got answers, do you?
Yeah, I do. I've got,
Okay, well, I've got
6 days of PHTLS IPD. Ask me anything.
something ready to show them if you don't mind.
Oh, no.
Is that cool?
Nothing exciting over here.
Okay, let me get it. Oops. Sorry, technical difficulties. Almost there. So this is a video from Dallas fire, and just take a look at those names on the page there. There's a lot of folks that are younger ages than we would like. I'm going to try and play this, but I don't know if we'll get like a copyright infringement or something, Jasmine, for playing a YouTube video on another YouTube video. So I'll try to see it, and maybe we'll get in trouble, or maybe we won't. I don't
I
know.
think you just have to cite it. You can probably
Okay,
cite it and throw the link in the comments.
Can you guys hear him or no? Can you hear him, Jasmine, talking or no? Okay, let me fix that.
When I both had it, she COVID-19 is a real virus. My wife and I both had it. She did way better than I did. It took me about 8 days to get better. It took her about 5. Tylenol was my best friend, along with NyQuil. This is very real. Whether you believe in the numbers or not, there are a lot of people who end up hurt or even dead, and they can't all be faking. So wear your mask.
I'm doing better. I take this day by day. I've been sick since March, early March. As you can see right now, I'm in the hospital. Been here for 2 days now. 4 months later, after all this, I started having living just as it was now. But I'm doing better. I've been sick since early part of March. I think that's one of the first ones in the fire department. This virus affects more than just me. Affected my family, not only just my wife, my kids, my mom, my dad have been involved in this. For me personally, it's affecting me. I'm not able to take care of my family like I used to. I can't play with my kids. My wife's having to do a lot more than what she normally does. She's now probably a little depressed because of all of this, but it's more than just me involved. And guys, you gotta wear your gear, you gotta wear your PPE, you gotta wear your mask on every call. It doesn't matter if it's a car wreck or just a welfare check. Put on your mask, keep it on for the duration of the call. You're in your station, keep your mask on. This is not just about you, it's about your brothers and sisters in the fire department. You don't want to get them sick and have them go through what I've been going through for the last 4 months.
Okay, so I'm going to pause it there, and I'm going to put the link to this video in the comments. And I hope that you guys will take a few minutes to watch this, because it's a good video, and it's highlights a few things. One, about protecting yourselves, but also about protecting your families, protecting each other, and what this thing can do long term, not just to older people. I'm seeing just so much more about long-term consequences of this virus, even to really healthy people. So with that, I guess we'll go back to the questions. Jasmine, did you want to talk about PHTLS then a little bit more?
Well, now that I've checked my email,
Ah,
nothing like a last minute addition. PHTLS is coming up. Our county PHTLS classes are going to be small classes with social distancing. So you'll see a lot more classrooms spread throughout the county. For different agencies, I know this is set up differently, but just make sure when you sign up for PHTLS on Target Solutions for Sunstar employees, or if your agency sends you to a class, that you check where the class is, because the small class size, we have multiple classes going at multiple locations, and we're trying to mix agencies at these classes for educational purposes. Obviously, you guys are used to working together, so we want to make sure you're working together in CME. So with that said, you might be at station 48 in room A or room B, so you need to know where you're going. And you might have two different units from different departments at one agency that go to different locations. So we have a couple South County locations going in North County at the same time, for instance. So just make sure you know where you're going, because you may not be going to the same location since we have multiple classes. We are taking extra precautions besides the small class size. You're going to have classes of 10 or less with 2 instructors. We are doing mandatory N95 masks throughout the class. So every agency will be, we're making sure that they're distributed at all agencies, and you will be given an N95 mask to hold on to, and you will wear it to your CME, and you will take it back with you, and you can reuse that N95, because obviously you haven't seen or treated a patient while you're wearing it. So
Wait. So this is a new thing, and the initial notification is just going out to the chiefs this afternoon. So you'll hear more about all of the various processes involved, and when you reuse, when you don't reuse, all that kind of stuff.
Right, and we can get more into that, but it's important to know that we are taking precautions, and we're going to continue CME because there are other things going on out there besides COVID, but we want to make sure everybody's safe and protected, and that you're still able to. We've all seen this rise in trauma patients. It's a perfect time for PHTLS. So we want to make sure that we refresh you on those skills. So,
yeah. So I just don't want to get too far into the details on how the N95s are going to work or be distributed or anything, because again, that's just a new thing. But the take home is that we have done really excellent work by folks like David Hudak and a few others. And our stockpile of N95s is getting to the point where we can take that appropriate or enhanced level of protection when we're doing in-person training, so that we can continue that training that needs to happen. And the idea then is that if somebody is in the classroom who then maybe tests positive a day or two later, if you were wearing that N95, you might not have to be on quarantine or anything.
So the details of the N95 are, coming out and coming soon. But in general, PHTLS is here, and it starts at the end of August. So just try to make sure that you're prepared for that. August CME will be your practice for PHTLS, and that test at the end of August CME for paramedics is going to be, there'll be a certificate at the end of that, and you'll need to bring that. That will be your pretest. So you won't have a pretest that you have to log in and take before you take this course. So we have that coming. So if you have any questions about that, we are continuing CME. And if you have any COVID related problems that cause you to have to work overtime, or that you're sick and you can't make it, that's okay. You can contact me or the coordinator for the site, and we're working with people. So we just want to make sure that you're continuing your education, and that we are still refreshing you, but we're still taking the precautions that we need to do that with COVID going on.
Awesome. Okay, so I've covered the status update. We've talked about our upcoming training on PHTLS, and we've talked about Shane's diapers. So what else do we need to talk about today? I don't have a huge agenda or anything earth-shattering to bring today. I would encourage you to watch that video that's at the link I put up there. Please remember that we continue to have significant exposures in group settings that are resulting in lots of people having to quarantine. And so please be cautious about that. Please do not let down your guard. Wear your PPE all the time, the baseline PPE. I will tell you that in the hospital, we are now, for the last couple of weeks, also mandated N95 or better and eye protection on every single patient, regardless of what they're there for. And we go up from there, just as we've been doing in EMS for a while. So good. Questions? Ready, go. No questions. Peggy, don't make me play music. I think they're a little behind, Jasmine, so I'm just going to give them a minute to catch up.
I don't see too much coming in over the chat right now.
There's 41 people on there. Okay, here we go. The questions are starting. Okay, so post-cardiac arrest patients, bradycardic and hypotensive, would you rather pace or give Levophed? I feel like I got that question in my email earlier today from somebody that I haven't had a chance to respond to yet. So I guess that depends on how bradycardic. If they are bradycardic, probably, to the point where I think that the bradycardia is the reason for the hypotension, like maybe they're in the 30s or lower, then I might try pacing. Alternatively, that a post-cardiac arrest heart is sort of going to be in cardiogenic shock. And so if they were 50s, maybe even 40s, I might try the Levophed. Levophed should get you both a rate improvement as well as squeeze improvement. So that's a tough question, and one of those ones where you have to take a scientific wild ass guess, maybe, and then see which one works. But either one of them would probably work. The Levophed might probably be my preference to start with, just in that post-cardiac arrest heart, particularly since I'm sort of killing two birds with one stone as opposed to only taking care of one part of it. Also, the electrical responsiveness of that heart to capture immediately post-cardiac arrest might be more difficult to get capture, but that's more of a guess than anything. So I guess if I were backed into a corner and had to pick one, I would say probably Levo, but it depends on how low the rate is. Maybe that would sway me if the rate was super low. So hopefully that answers that question. Have you seen any research on ozone therapy for COVID-19? I have not seen any research on ozone therapy. I've heard people talking about hyperbaric therapy, but I haven't seen anything on ozone. So put something in the comments there, Chief, if you have a specific reference or something like that. Here's one. I know you don't work on the ped side. Do you know if the hospital has a large uptick in trauma, pediatric calls, trauma, medical related drownings? So I think trauma calls in general are increased significantly. I've noticed a little bit of an increase maybe in drownings recently, but that's anecdotal. I don't have a number to back that up. But I would say that we are seeing a lot of trauma, shootings, stabbings, etc. So be careful. It's July, remember? We've got the new interns in the hospital. So that chest tube that we had to put in the other night maybe took a little longer than it might normally, but we got it done. There is certainly seeming to be an increase in trauma, probably primarily penetrating trauma, but seems to be blunt trauma as well as people go out and do stuff. Breaking news from ESPN: MLB postpones all Marlin games through Sunday after coronavirus outbreaks. Yankees, Orioles, and Phillies are impacted. So there you go. It ain't over yet. Anecdotally, we're seeing increased trauma. I think that's pretty clear on the calls with the medical directors from other places in the country. They are seeing similar. There's a paper being worked up right now that we were able to contribute some data to on increasing numbers of out-of-hospital cardiac arrests. And early word is that in that data, which includes 50 plus EMS systems, that we're seeing significant increases in out-of-hospital cardiac arrests during this. And then the next question for that group is going to be, are we seeing something statistically significant in our trauma volumes. So I would anticipate we'll have more information on that shortly, but at least anecdotally, yes, we're seeing significant increases in trauma volumes. George says, do we need to be concerned with dislodging embolus when pacing COVID patients? So I'm less worried about giving them a stroke when I'm trying to keep them from going back into cardiac arrest. It is a potential concern. Most of the time, clotting inside the heart itself, if you think about like an AFib type picture where we worry about converting them back to sinus rhythm without doing the transesophageal echo, no, most of the time in that scenario, people say that up to maybe even as far as 24 hours, you can pretty safely convert them back sinus without the TEE. They actually do that a lot on the West Coast. East Coast of the US, we tend to be more conservative with that. It's a possibility, I suppose, but not the thing at the top of my list in a pericardiac arrest type patient. Much more important at that point to me is going to be to restore some reasonable perfusion to the vital organs. So maybe a quick lecture on how T and B cells impact immunity in relation to SARS-CoV-2, since we have a phase 3 trial going on. Okay, that's, I think somebody just volunteered to give a lecture on T cells and B cells on next week's broadcast. What do you think there, sir?
I think that's what just happened.
I think he just volunteered to do that. I guess what I'll say in relation to that is that even though you had the New England study that showed that, no, wait a minute, this is what happens when you ask questions. So perfect. So next week we will have a presentation by somebody from, I'm not going to say which person necessarily is going to get tasked with this because I have a feeling that it will get delegated. Somebody is going to talk to us about antibodies versus T cells and B cells, like a quick 10-minute max type thing to talk about why, even though the New England Journal article showed that antibodies seem to be decreasing in their numbers within about 90 days, that may not fully preclude you from having ongoing wow, it's a long day. May not preclude you from having an ongoing ability to be immune from the virus. So that is something that's actively debated. And good point, there are 2 trials that are currently underway, that is phase 3 trials. And so here's a question for the group. Would you volunteer to receive one of the phase 3 vaccines as part of the clinical trial? And the reason I ask is that most of the trials are looking for people who are at increased risk of exposure, and clearly we are that. They are also in general looking for relatively healthy people at this point, and we are a relatively younger slice of the overall population. So I'm really curious, in the comments, I'm really curious what your thoughts are. Would you volunteer to take that vaccine? Jasmine, would you?
I have to think about
Here's
that.
putting you on the spot. Yeah, you do have to think about it. It's not an easy choice. It's not, right? And it's easy to say yes, but then when you actually think about getting injected with a still relatively early experimental biologic, you can see how somebody might have you can see how somebody might have a little pause.
Sounds like a great idea. To think
Right.
about yourself personally, you definitely have to think about it.
Right. It gives you a little pause when you think about actually putting the needle in your arm, right? So what I will tell you is that there are 2 trials currently enrolling, and if anybody is interested in being a subject in those trials, you can find them on the clinicaltrial.gov website, or email me and I'll send you the link of how to sign up to be screened to be a participant. And if enough people really wanted to be involved in that, we could certainly look to try to become a site. there are, I believe, at least one other EMS system in the state who is potentially participating as a trial site for the study, because obviously first responders along with healthcare workers are in that group. So I'm super interested with what people's reaction to that would be, whether they would be into volunteering or not. We'll see if the comments,
Really
if
quiet
anybody
in the
wants to
comments
chime
section.
in. Yeah, exactly. Ozone therapy. Well, send me a reference on that, other than your dentist, if you have one, like maybe a journal article or something. Sorry. And I definitely would like to read about it. Julie says it's a live virus vaccine. There's two different kinds, is my understanding. You can read about the specifics either in the news or in the actual journal articles, or go to, clinicaltrials.gov, I believe. Let me see if I can pull up the site. I had this open earlier today, but there's this website. I'll share out the page here so you guys can see it, called clinicaltrials.gov. And you can go there and find all active federally registered trials. And then you can come in here and type in the search. I actually have the numbers for the specific trials. If anybody is really interested and can't find it, just pop me an email and I will, or you know what, maybe I can do this. Maybe I could just put the, there you go. Okay, so if you want to read about it, here is trial number 1. Hopefully that link works. Let's see. Uh-oh. I don't think it's a link. Let's see. Let me try that again. Here is the one study. And the other one is, see if I can open it up and get it for real. There we go. So there are the two studies, one from Moderna and one from Pfizer, of the two vaccine candidates that are currently in phase 3 in the US. And so, read about it, see if it's something that you're interested in. I bring it up because I want us to, know that people are working really hard and we're moving very fast in terms of the vaccine, but we're just now enrolling in phase 3. And normally that means you're like 2 years still away from a vaccine. So, I don't want people to get the idea from these that we're there and it's over and we're good to go. Because we're not. And we're seeing that curve come down. And the appropriate response to that curve coming down is to say, awesome, maybe we're not helpless against this thing. Maybe some of the things that we're doing as a community are working. We hope anyway that that's why it's coming down. And so the appropriate response is keep going, don't stop, keep your foot on the gas. Let's drive this thing back down. I mean, if you think about where we were a month ago versus where we are now, I'll go back to this window. I would sure like to see us get back down in this range. That would make me super happy. We're still obviously up here and we need to finish driving that back down. So at the end of the day. Don't let up. Redouble. Now would be the best time to redouble your efforts to really do all the things that we're asking and make all the sacrifices that we're asking to really drive this thing into the ground. So there you go. All right. Any other questions? It is 3:40. So we've been at it almost 40 minutes so far. And we'll give it just another minute or two for any other questions. I know that Sunstar Clinical Services will not ask any more questions because they got homework. Jasmine, remind me that when I play a YouTube video, it delays the stream and they are super far behind us now.
Ooh, that's good to know.
Few
Yeah, last time I played a video, I had the video downloaded.
Yeah, which I didn't. So it messed up because I guess I'm streaming us from my internet connection. So I would like to see a few PCEMS sponsored dogs for COVID testing. Are you talking about for sniffing COVID, like they sniff cancer? Because I'd love that too.
Can we just bring them to the CMEs and then let them loose?
The only problem is I think there's some data out there that that dogs can carry and or transmit COVID. Is that true? I thought I read that somewhere. I don't know if that's true or not, so don't take that one to the bank. But I can't remember whether or not dogs can actually become infected. Which I don't know how your dog does their sniffing detection while wearing appropriate respiratory protection. So that could be troublesome.
Specialized N95 fitting.
There's the other half of the email about the pacing versus Levofed question. The person who emailed me that earlier just emailed me back that they were listening and they were okay with the answer. So good. One less email I have to send today. All right. So we'll give it just another minute or two for any final questions. I'm going to play music. Okay. Well, I don't see any other questions coming in. So we're going to do this again next week, right, Jasmine?
Yes.
Okay, sounds good.
I mean, yes. As long as nothing pops up on your schedule, no BCC meetings. So.
There may be actually, so we may have to push a little bit, but we'll see.
So just keep an eye on your target solutions. I get the information out there as soon as I can.
Yeah, I'm sorry for the moving around in schedules, but it's trying to accommodate multiple different calendars.
If you have any CME questions, you can shoot me an email.
Okay. Let's see. I think Chief Bessler, I'm going to call you out real quick. Chief Bessler, are you able to call my cell phone?
We do need music for the long pauses.
Oh, you could hear it. Okay. Chief Bessler, you're live on the air. What were you talking about with ozone?
My dentist is also an ozone researcher.
You gotta mute. You gotta mute your YouTube.
It's just like being on a radio show here.
Totally right.
Better?
Yeah.
So my dentist honestly has been studying ozone therapy for a number of years, and she's aware of some research that's been done with COVID-19, specifically in Italy, with some very high success rates. And I made the offer to put her in touch with the health department, the doctors that I know there, and she's willing to talk to them to see if there might be something we can do with that. But I was just curious if you had heard anything about it.
No, I haven't. But if you have an article or something, definitely let me know about it.
Absolutely. I'll get in touch with her and ask her to send me some research articles that she's got.
All right, cool. Any other stories about Shane that you want to share?
You mentioned that this is live.
Okay, fair enough. Okay. All right. Thank you, sir.
Thank you.
See you. Just trying to see if we could actually take phone calls, which we can. So cool. All right. I think we're about done unless anybody else has any other questions. Chief Meisner said, don't do it. All right. Thank you, everybody. Please stay safe. Please keep up the PPE. I know it's a pain in the butt. I know it's hot. I know it stinks. Please just do it. We've got a long way to go with this thing, and we've all got to stay safe. So, all right. As always, email, call, whatever, with any questions or things that you need, and we will talk next week. Thanks.
Bye, everybody.